Hi, everyone. My name is Dr. Susan Kaufman, and I am an obstetrician gynecologist and a pediatric adolescent gynecologist who works for Virtua Health in southern New Jersey. And Michelle, Parenting Special Needs magazine has asked me today to speak about reproductive health care. Now, you may wonder why we want to talk about this topic, and I am going to enlighten you. So, I really want to thank Michelle and Shante for inviting me to talk about this very important topic. So, reproductive health care is a very broad area, and it encompasses well care, and it also encompasses complicated gynecologic care. The American College of Obstetrics and Gynecology and the American Association of Pediatrics actually recommend a visit for all teenage females between the ages of 13 and 15 to come to the gynecologist for a well visit and become familiar with the office, the provider, talk about menses, check in and see how they're doing, talk about nutrition, exercise, decision making, and of course, any other concerns or questions that the adolescent or her parent may have. However, when it comes to young ladies with special needs, we actually recommend starting gynecologic visits when you first notice pubertal changes. So, when you're first noticing breast growth or hair growth. And the reason is that we want to be able to counsel parents about the pubertal process and also what to expect when periods start. Many parents are really concerned and worried about how their daughters will react when their period starts, how to teach them about their periods, how they're going to behave, whether it will impact school, whether it will impact the family, and how are they going to handle it. So if we can do counseling and education before someone's period starts, then we're way ahead of the game. And we can offer parents suggestions on how to educate their daughters and how to deal with this process. So that's the reason that we recommend starting early. Now, let me reassure you that this visit does not include a pelvic exam. In fact, in pediatric and adolescent gynecology, we rarely do any pelvic exams on anybody under the age of 21. Now, to clarify that, if we have a young lady who comes in with itching or burning or abnormal discharge, we may need to do a genital exam, but that will not involve a speculum or anything invasive. And most of the time, there is no reason to do a genital exam. So when a young lady first comes in, whether it's before puberty or coming in for problems later on, once their period starts, we're talking about their medical history. We're trying to find out if they have medical issues that are affecting their periods or if their periods are affecting their medical issues. We are assessing how they are reacting to their periods. Have they learned how to take care of themselves? Do they still need assistance with pad changes? What's happening with their behavior during their periods? How heavy are the periods? And are they becoming anemic because of their periods? So these are some of the things that we look at when adolescents with special needs come into our office. We also deal with a host of other issues besides periods. We deal with other hormone imbalances such as polycystic ovarian syndrome. We deal with anatomical issues, chromosomal issues, bleeding disorders, and so on. So we do a lot of comprehensive care as pediatric and adolescent gynecologists. But most importantly, if we can start early and we can help parents and adolescents through this process, then we're really accomplishing a lot. When parents come in, once their daughters have started periods, Some of them are doing just fine and they don't need to intervene with the periods, but we might order some blood work to make sure that they're not anemic and to check their iron levels. Other parents come in because they want to stop the periods. And that's maybe because the periods are too irregular, too long, too heavy, affecting other medical problems, or their daughters just are not tolerating their periods. It may affect their behavior. It may affect them going to school and being involved in other activities. So they want to talk about what we can do as gynecologists to help them. So let me talk a little bit about that. First of all, there's a lot that we can do to help somebody with their periods. And sometimes it's just controlling the periods, but let them go on. And sometimes it's actually getting rid of the periods. So we have ways of controlling the periods and we have ways of getting rid of them. And when I talk about getting rid of periods, I always explain that this will do no harm. It will not affect somebody's reproductive tract. It will not affect their ovaries, their uterus, their tubes. If the patient has potential for having children in the future, treating them as a teenager will not cause infertility. So if we're talking about controlling bleeding, we generally do that hormonally, although I'll tell you in a moment about some other options. And we have pills, we have patches that go on the skin. If a young lady is able to use a tampon, we have rings that go in their vagina. We have injections, and we have something called an implant, which is a little rod that goes under the arm here and also controls periods. When we're talking about these medications, we talk about whether somebody wants to have a period or doesn't want to have a period. And if they don't want to have a period, then we dose these medications in ways to take away their period. And when we're doing that, as I said, we're not doing any harm. And all we're doing is flattening out the lining in the uterus so nobody bleeds. It doesn't cause any damage. And as soon as the medication is stopped, the periods come right back. So again, we can accomplish taking away periods by how we administer the medication. Now, for some people who don't want hormonal medication or they have contraindications to hormonal medication, we do have non-hormonal medications to control bleeding. And these are basically given during a period and they cause clotting. And so they decrease the amount of flow. So people are coming in because they're concerned about their periods. Another reason that somebody might come in is because of cramps. And the cramps may be so severe that they're having trouble getting out of bed, going to school, negotiating their life. And we have many ways of helping young ladies with cramps. First of all, we're going to talk about why she might be having cramps, and we want to look for any underlying causes, like some obstruction to the blood flowing out the way it should, or possibly talking about endometriosis. Sometimes we find an underlying cause, and sometimes we don't, but nevertheless, we can treat the cramps. If we're treating periods and cramps, we can utilize medicine to take away the periods and therefore take away the cramps. If we're treating just cramps, we can still use hormonal medication, or somebody might elect for pain medication, or somebody may want to talk about complementary medications such as herbs, acupuncture, and so forth. So again, that's another way of helping somebody with their periods to improve their quality of life. Now, someone may come in with other period issues. Behavioral changes is a big one. A young lady who doesn't understand why she's bleeding each month may become aggressive. She may engage in self-injurious behaviors or aggression towards people around her, like her parents, her teachers, people in her classroom. And again, a gynecologist can help with this. We can improve the mood mood swings or behavioral changes that occur with periods so that we can help improve the quality of life of this young lady. Um, Backtracking a second, when we talk about bleeding, if somebody's bleeding excessively, we are not just jumping into treatment, but we are also looking for underlying causes. Somebody may have a hormone imbalance, such as thyroid disease, or they may have a bleeding disorder. So, the first thing we do when someone comes in for a visit that is not a well visit, and they come in with a problem, we're assessing the problem, we're looking for underlying causes, and then we're talking about treatment. Other menstrual issues may be acne, fatigue, appetite changes, and we deal with those as well. So, besides menstrual issues, other parents want to talk about sexuality, especially if their daughter is getting into the late teens and early 20s. And this is a really important topic to talk about because we want our children with special needs to be out in the public, to be in school, to maybe get jobs if they're able, to have relationships. And so these are all subjects that should be addressed and a plan of action created around them. Other young ladies may come in because they're not getting periods at all. And that may be related to underlying medical conditions or genetic conditions that they have, or a long list of other reasons. And again, we're going to look into an underlying cause and talk about whether this should be treated and how we treat this and why it should be treated. So, to sort of sum up where we are at this point, I want to say that it is important for all young ladies to come to the gynecologist. And if they are special needs, we want to see them earlier rather than later to do counseling and education when puberty starts and before their periods start. So we can help parents and patients figure out what's going to happen, how to deal with it, and to let them know that we are here for them and we can help them. We want to also help the young lady to be independent and to be able to advocate for herself. And we want to educate the people around her. So I hope that this brief talk about reproductive health care was helpful. If you have any questions, I'm sure Parenting Needs Magazine has a forum for you to ask questions. And I want to thank you again for inviting me to talk about this crucial subject.